of love over the past 3 years, and I'll go through it with you now. So the reason why we wanted to, doesn't seem to be wanting to move between my slides, Sue, sorry. Can you see it changing? Oh yes, here we go. Yeah, brilliant. Sorry about that glitch. Caught up eventually. So the reason why we wanted to do this project in the first place is what we were finding with our clients is that we're getting very variable rates of ewe mortality in our clients' flocks, and it could be quite frustrating, especially when they were already following best practice management and following lifetime ewe principles. So we wanted to know how could we do better, and the way we thought about doing this was we wanted to work out what those major causes of ewe mortality were over that lambing period, and really work out what was an achievable rate of loss in this period. So in order to do so, we had 3 aims. First of all, we wanted to determine the mortality rate over that lambing period. And then we wanted to identify what the causes of those ewe deaths were. And then from there, work out what factors were contributing to those deaths so that we can make recommendations to improve it. So overall, we had 51 producers in total in over 2 years. 40 producers were involved in 2019 and accounted for 105,000 ewes. And in 2020, we had 41 farms and that accounted for 120,000 ewes. So 32 of those properties were involved in both years of this study, and we had to do some replacements in the second year just because of logistical reasons. So all of these, as you can see, are based in Southern Australia, and it's also important to note that all of them were in non-merino ewes. So our methods were, we sort of went with a two-pronged approach. So of these 51 farms, we asked the producers to record any ewe deaths in a farm diary from the time the ewes were first placed into their lambing paddocks all the way up until marking. So anytime those producers were checking their paddocks, and it's important to note that this was as part of their normal management, we didn't ask them to change anything that they would usually do. So anytime they'd check them, whether that be daily or every 2 days or what have you, if they found a dead ewe, they were to record it in this farm diary and record if there was an obvious cause of death. So obvious causes of death may be something like a stuck lamb, and you can sort of see in this photo here that there's a big swollen stuck head in this ewe's vulva, or something like a uterine prolapse. So anything that was obvious they'd record, and if they didn't know what the reason was, they'd just call it a no obvious cause of death. Secondly to that, in these farm diaries, they were also asked to record the number of ewes that entered those paddocks and the number of ewes at the end. So between that and the deaths that we got in those farm diaries, we could sort of work out a rate over this lambing period. Secondly to that, we also asked them to record if there were different litter sizes in those paddocks, what the breed of the ewe was, what the sire of the lamb breed was, and from there we could sort of start to look at our risk factors. Our second approach was to look at post-mortem results, and over the 2 years we looked at 595 post-mortems, so did quite a substantial number of post-mortems in that period, which accounted for on average about 18% of the ewe deaths in each farm in that period. So we would do these post-mortems on any ewes that had died in a 48-hour period in the previous 48 hours, and we'd go out to these properties on 3 time points throughout the lambing period, and we asked producers to give us a call if there were any bigger loss events, and we'd try and come out when they had those. We also, on a number of postmortems, got worm egg counts where we had fecal samples, and then we also took eye fluid samples because they can give us an idea of if there were any metabolic diseases at play. And we'll discuss that further down. So from those farm diary results, we got some averages of the mortality that we were finding over that lambing period. So important to note that these results are not annual results. This is just over that lambing period. So on average, we had between 2 and 2.5% mortality on these properties. The top 25% of producers were sitting at below that 1.4% mark. And then the bottom 25% of the producers were sitting at the sort of 2.5% to up to 6% mark. So quite a range. But I guess two things to take from that is that in general, we had producers that were already conducting best practice management. So we do sort of expect to see these lower mortality rates, but also that there was definitely some room for improvement in that we had UDEaths in the 6% mark. So definitely room for improvement, and we can go through those now. So when we look at the farm diary results, so the producer recorded causes of death, the number one cause that producers found was stuck lambs. And you'll see when we go through our post-mortem results, this is very much mirrored in what we were finding. But the difference being in that the second common cause of death recorded by producers in their farm diaries was no obvious cause of death. And to be honest, this makes complete sense because there's not many ewes you can just look at without doing a post-mortem and be able to tell what they died from. So those post-mortem exams really do help, because when it came to doing our post-mortem results, you'll see that there wasn't nearly as high a percent that we couldn't sort of work out what the cause of death was when we did those post-mortems. So that's important to know. The third most common was cast ewes, and we often do find this over the lambing period that often ewes get cast. When we were going through and actually post-morteming the ewes that had become cast, we often found that there were other things going on, and I'll discuss that when we go through our post-mortem results. Other causes were things like infections post-lambing, or we had a group of ewes that had apologies. We had a group of ewes that had filarial staggers and just odd conditions like that. We did also find that there were a few cases of uterine and vaginal prolapse. And what I was starting to find when I was going out and doing these postmortems is that often certain producers or their stockmen weren't always too clear on what the difference between those conditions were. So I thought it would be quite a good idea to go through those now. So when it comes to uterine prolapses, what happens is after the ewe lambs down, the uterus can then essentially turn inside out post-straining, and what can often happen is the arteries sitting on either side of this uterus will stretch to such a point when the uterus comes out that they tear, and that will cause severe blood loss, and that will kill the ewe. So the way you can tell that this is a uterine prolapse versus a vaginal prolapse is you see those cotyledons, and that's where the placenta attaches. And so by seeing those, you know that the uterus is actually turned inside out and that ewe has indeed already lambed. Now, in comparison to a vaginal prolapse, where we just see the smooth surface, and they're not often as bad as this, they can sort of be a little bit smaller. Often these do occur before the ewe actually lambs down, and it can be quite a frustrating condition because we tend to see it in high body condition score ewes, so anything above 3, and often they haven't lambed yet, so if we don't do something about it, these ewes will end up having problems with dystocia or difficult lambing, and can then get these secondary problems with their uterus either tearing or their bladder tearing, because often the bladder can get trapped in here. So quite a number of producers in this project were using these ewe retainers, and a lot of people really like them, and I like them because I think that you can really, if you can get to these ewes before they get to this large stage here, you can actually end up using these retainers and getting a healthy ewe and healthy lambs at the end of it once they actually do lamb down. So in looking at the risk factors of these on these farm diary results, what we found was that triplet ewes, when we compared it to single and twin bearing ewes, had a much higher risk of higher mortality risk. So we were sitting at a sort of above 5% mortality rate in these triplets compared to a less than 2% when we compared it to singles and twins. So quite a big difference, and really worth keeping in mind that these are a risk group. So if you do have a risk flock, a highly fecund flock, that they're at greater risk of mortality. So you sort of have to keep a stronger eye on them. And then the other risk factor we found with these farm diary results is that ewe lambs so maiden ewe lambs, as opposed to maiden hoggets, had a much higher risk of dystocia or difficult lambing, and it was a 2.6 higher risk of dystocia compared to their 2-year-old counterparts. So really, if you've got these young maiden ewes, paying close attention to them over the lambing period is quite important, because they are at a much higher risk of dystocia. So moving on to our vet post-mortem results. So first of all, like I said, we only conducted post-mortems on a proportion of ewes that died over the lambing period. It wasn't every single ewe on the property, so it was about 18% of the ewes that died. And the difference between the results that I described here compared to the farm diary results is that ewes that were post-mortem could often have multiple diagnoses associated with them. They could have up to 4 or 5 diagnoses as the cause of death, and that's because certain conditions can lead to consequences of each other, and we're just getting a snapshot when we do a post-mortem. We can't say the exact thing that caused that death, but we know that there was a sequence of events that led to those deaths. So the reason I bring that up in great detail is because these top 4 conditions here, the dystocia, the septicemia, trauma, and hypocalcaemia, often did go hand in hand with each other. And in my next slide, I'll go through that in a bit more detail to sort of drive that point home. But as with the farm diary results, dystocia, or these stuck lambs, was definitely one of our biggest contributors in this project to death. Septicemia is a term that you might also be hear as being called blood poisoning, and often that was either due to an infected uterus or an infected abdomen post a uterine tear. And then these traumas are this grab bag term that we use for anything that was a traumatic cause, whether that be torn bladder, uterus, or uterine artery, or torn abdominal muscles. Anything that was traumatic was considered a trauma. And then we also had a number of ewes that died with hypocalcaemia, and it can be hard when you're just doing postmortems and looking at these aqueous humour samples to know whether that ewe died because of that hypocalcaemia or from that hypocalcaemia, and I'll go through that in a bit more detail. But also noting here, like I said, with those postmortem results, that we had a far, but when we compare these postmortem results to the farm diary results, we had a far smaller number of unknown causes when we did these postmortems. So really important to add this to your repertoire if you're not already doing it, as having these postmortem exams happen on your property. So, like I said, these conditions often do relate to each other. So this is an extra term that we've put in this graph here to sort of show a combination between the traumas and blood poisonings that were due to pregnancy or birth. So this scary looking image here is just to try and give you a sense of what conditions can interlink with each other. So if you've got this prolonged or difficult birth process, this can either be because you have a low calcium, so you've got a low calcium for whatever reason, and I'll go into some risk factors to do with that, and you can the uterus can stop contracting because of this. That will lead to a prolonged or difficult lambing. Or alternatively, you could have a difficult lambing that ends up meaning that the ewe is straining for a long period of time. She goes off of food and she ends up with a low calcium. Then from there you can get these traumas associated with the dystocia, and these traumas were often these ruptured uteruses or ruptured bladders, and this can then lead to a septicemia, which is a blood poisoning, which is often due to infected abdomens or infected uteruses. So you can sort of see that these conditions can all start to interlink with each other, but really the take-home message is that the inciting cause is most likely often this dystocia, and that's sort of one of our biggest take-home messages, is that dystocia really does play a strong role in periparturient, so lambing ewe losses. So from this study, what we found was that if blood poisoning was the cause of death, between uterine infection and abdominal infection, they sort of played a similar role in how many causes we were finding with those. And this extreme image over here is actually showing the severe infection that would have been caused from a lamb actually sitting outside of the uterus. So once we'd gone in and done the postmortem, this lamb had actually torn outside of the uterus and had actually started to get stuck to all those organs due to that severe and overwhelming inflammation and infection process. And then our trauma cases, overwhelmingly uterine ruptures were our biggest cause, and followed by these uterine artery ruptures, as you would see with these uterine prolapses, as I discussed before, or bladder ruptures. And here you can see this nasty torn bladder post-lambing. So this slide here is to really drive home the point that a lot of the dystocia cases that we uncovered from postmortem weren't actually obvious until we did that postmortem exam. So if 56% of them had an obvious external signs, whether that be a lamb's head or arm sticking out and severe trauma the vulva of the ewe, but 44% of them, so a very decent proportion, were only detectable once we'd actually started to cut in and do these post-mortems. So that's a really important take-home message with this project, is that often what producers were saying was, wow, like once you actually did the post-mortem, I for sure thought that was probably going to be a hypocalcaemia or a preg tox, but it in actual fact it was a dystocia once we'd cut in. And of those dystocia cases, 60% of them were these malpresentation cases, so where the lamb is coming in the wrong position. So lambs should always be coming with their head first and their arms presented either side, but if they're coming with either just one or two front legs back, or their neck flex back, or anything like that, that's going to cause dystocia issues. And that was one of our biggest causes of dystocia, were these malpresentations, and then followed by fetal size, and the group of ewes with that had a high fetal size tended to be the singles, whereas malpresentation was more an issue with twin-bearing ewes. And then it's shortly followed with uterine inertia, and that could often be a problem with low calcium levels, can lead to these uterine inertias. So one of the risk factors that we found with hypocalcaemia was that ewes that were above 5 years old were at a much greater risk of dying with hypocalcaemia compared to 3-year-olds, 3 and below, and ewes and body condition score of less than or equal to 2 were at a much bigger risk. So if you're finding in your flock that you're getting these issues with hypocalcaemia, then checking to see if you've got a high proportion of aged ewes, or your ewes are in low body condition score, can really sort of help determine if this is going to be an issue in your flock. And one other condition I wanted to mention, which we would have never before doing this project have thought to have been occurring in such high numbers, was this rather spectacular condition called dorsal vaginal wall rupture. So this happens when the top wall of that vagina tears, and the intestinal contents can then intestines and the intestinal contents can then sort of fall through the hole that's been caused there, and it leads to sort of severe bleeding and subsequent death. And in 2020 in particular, 11% of the cases that we diagnosed with problems had 11% of the cases that we diagnosed had dorsal vaginal wall rupture. And what we found were the risk factors with this were threefold. So first of all, if ewes had a body condition score of above 3.5, or they had a very high total litter weight, or were multiples, they were at much greater risk of dying with this dorsal vaginal wall rupture. So again, looking at those risk factors, and if this is a problem on your property, managing those is going to really help reduce the rate of these conditions. So just to sum it all up, we do have sort of some old and some new problems identified. We knew that dystocia was always going to be an issue during the lambing period, but we definitely didn't realize to what extent it was going to be. So, you know, for every 2 ewes that were being diagnosed with dystocia, you miss one without doing a post-mortem exam. So really important to add that to your repertoire when you're looking at your lambing ewes. And like I said, anecdotally, one of our clients had said to us, I really didn't think this was going to be dystocia until you opened it up. So doing these post-mortem exams is pretty important. There have been some opportunities for differential management highlighted through this project. So with hypocalcaemia, managing those old skinny ewes, and for conditions like dorsal vaginal rupture, managing your heavier multiple bearing ewes. And so just noting to manage your seasonality a bit better, and that was highlighted with the ewes with dorsal vaginal wall rupture. When we compare our New South Wales clients compared to our Victorian clients, often because the season was so much better in 2020 for those New South Wales clients, that often we found that their body condition score was a lot higher, because they didn't have the opportunity to manage those their condition score as well because of their low stocking rate. So knowing managing your season is going to really play a big role in that. Now, when you're looking at your targets of ewe mortality over the lambing period, first of all, you actually have to go out and make sure you're recording your ewe mortality. So that's your #1 goal. So recording those ewe mortalities from the time you put your ewes into their lambing paddocks up until marking. You can then know that if you've got less than 1% mortality over that period, you're doing a great job. You're sitting well within the realms. Stick with it. If you're sitting at that 2% mark, you're doing a good job. But when you start getting to that 3 and above mark, there are opportunities for improvement. And so that might be to start to look at exactly what causes of death you're finding, and a good place to start is to actually just record anytime you find a ewe dead in your paddock, and what you think that might be caused by. But like I said, often there are conditions that you can't tell just from looking at you have to actually go in and do a post-mortem exam. So with ewe age, you want to make sure you don't have, if you're using ewe lambs in your flock, making sure that they're not underdone ewe lambs, so making sure that you get them to their target weights when you're joining. And then old ewes, knowing that you've got them and perhaps separately managing them and carefully managing them will play a role, because they were a higher risk flock for death. And then we can also look at the sort of genetic component of it too. So with your ram selection, trying to pick rams that have similar ASBVs, and also making sure that you don't have rams that are producing birth weights that are too high or too low, and getting that nice in between, but also making sure that you've got that sort of precision management, that they're all at a similar level. You don't want in-betweens where you're getting these extremes in lamb weights. And then another ASBV that can be really helpful, especially if you're getting these dystocia issues, is lambing ease. And this ASBV can be a bit harder to find just in the booklets, but easier online. But essentially, if you are a self-replacing flock, looking at the lambing ease daughters will be really helpful, because this rams that have this ASBV will produce daughters that have easy lambings, whereas if you're not self-replacing and they're just going off to the meat market, then you'd be wanting to just base it on the lambing ease direct ASBV, and there's some really good information out there on ASBV websites, so I encourage you to look at that. Now, if the other thing that you'd be wanting to look at is scanning and differentially managing your ewes. So a lot of the producers in this project were separately managing and scanning their ewes already, but making sure that you keep them at the right body condition score and not just concentrate on the average, but also look at the heads and tails of those mobs, and making sure you've got a more congruent mob is quite important. And then also looking at the age structure of your flock and making sure that if you do have aged ewes, that you're managing for conditions like hypocalcaemia. And if you've got a very young flock, just knowing that dystocia is going to be, will most likely come into play. So just managing that as it comes up. So when we've got our condition score that's a bit too low, like I said, you've got your hypocalcaemias, but then you get your low birth weight dystocias, your preg-toxes, and it will also end up causing problems with your lamb viability. And then if you've got ewes that are in too high a body condition score, you get these dystocias from oversized lambs, and that's definitely a problem with our single bearing ewes. And then also trauma and such as dorsal vaginal wall rupture or preg-toxes. So we talk about managing our ewes over this period with precision ewe management. So with pre-mating, we want to be having our target joining sizes of our maidens right. We don't want to be undercooking our ewe lambs. We can then focus on our ASVVs for ram selection and our ewe genetics as well. And then in early and mid-pregnancy, you can concentrate on your ewe body condition score, making sure that they're sort of at a similar rate from the time that you're joining all the way up to scanning. And calcium supplementation may be something that you can consider here, depending on what you're feeding your ewes. If they're on a grain diet or stubbles, then you can consider using calcium. But knowing what the calcium levels are in your region is important there. When we're looking at late pregnancy, again, ewe body condition score is really important. We don't want them to be sitting at too fat or too thin. We're sort of wanting to aim for that body condition score of 3. And again, if calcium supplementation is something that you need in your flock, definitely making sure you add that to your repertoire, and worm control and nutrition is going to be important over this period. And then during lambing, making sure that ewes have become used to you. If you plan on checking your ewes, don't just decide halfway through lambing that you want to start doing twice-a-day checks when you haven't been checking them at all, because you're going to end up with issues of causing dystocia issues. Also making sure that you're providing adequate shelter, which is really important when it comes to multiple bearing ewes for lamb survival, and then also keeping your mob size as small as possible. Yeah, just be very careful when you're pulling lambs too, because what we found in this project was that often we were getting these dystocia cases, but we were also getting cases of post-lambing either paralysis or traumas, or blood poisonings post either a hard pull or dystocia related issues. So when you're pulling those lambs, making sure that you are adequately trained in doing so, and you know what direction you should be getting the lambs in before you pull them out. Wearing gloves can be very important, because we do get these uterine infections, and trying to minimize as much bacteria as possible from getting into that ewe's uterus is so important. And then also speaking to your veterinarian to make sure that there's not anything extra you can be doing, especially when it comes to these ewes that have had really hard pulls. It might be worth talking to your vet to get some antibiotics and anti-inflammatories in particular to try and prevent against these post-lambing infections. So finally, I'd like to just do a few acknowledgements. So first of all, to Meat and Livestock Australia for funding this project. And then second most important is definitely our producers, without whom this research would definitely not be possible. And then as well as the teams involved in this project. Thank you very much for your time, everybody. I'll now invite you to ask any questions you may have.
That's great. Thank you, Mary, for giving us a really comprehensive rundown of the 3-year research project and for distilling the points. It's some really good take-home messages for producers. So just remind everyone, we do have time for a couple of questions before we jump on to Andrew's presentation. But don't forget to use that speech bubble to type your questions in there for Mary. So Mary, the question I have is, like you made the point a couple of times that we have these sort of undiagnosed dystocia issues, and unless producers, I guess, have a bit of a handle on whether it's dystocia or not, it's hard to decide what to do. So certainly, you know, for lamb survival, there is a procedure out there, like a simplified overview of how to do a lamb autopsy. Do you think that kind of simplified, you know, easy step ewe autopsy system would be useful as well?
I think it definitely could come to play for sure, and I think also if you can't get a vet out to do it, certainly giving it a crack yourself, doing it on these users is quite important, because what we were often finding, there was quite obvious traumas. I mean, obviously you have to get an idea of the anatomy and what's normal and what's not, but once you've done a few, you'd definitely be able to tell when you've got these dystocia related issues, because they were quite spectacular and obvious. Either the lamb's literally sitting within the abdomen, not in the uterus, or these sort of signs of infection. So I think potentially that could be a great tool. And as part of this project, MLA will be putting our post-mortem protocol online, so keeping in mind that will be up for people to look at, albeit it does have a few veterinary sort of terms in there, but it does have that step-to-step process that people can go through.
Sounds like a great tool. Okay, so we'll move on to, there's no questions coming through, so in interest of time, we'll move on to Andrew's presentation. So while I introduce Andrew. So I guess this is the second step that Andrew's going to talk about this project. And he's going to talk about deciding, using all the information and taking, I'll just make you the presenter, Andrew. So about taking all the information from that research project and looking at it in more thoroughly from a practical point of view, and giving us some sort of steps and some targets to follow about decision making about whether the ewes are fit to join. So Andrew is a veterinarian. He also works for Livestock Logic. He's based in Hamilton in Victoria. These days he mostly works as a sheep consultant with producers in Victoria, South Australia, New South Wales. He also runs his own sheep enterprise, breeding white Suffolk rams, and does some livestock trading as well.